Mr. Speaker, we have a retention and recruitment crisis in our healthcare sector that has resulted in emergency room closures in rural hospitals like my hometown of Sackville, people being asked to avoid emergency rooms in urban hospitals, shortages of physicians, nurses, radiation technologists, and anesthesiologists within our public healthcare system. Mr. Speaker, this makes me deeply concerned about the Minister of Health's plan to create private sector competition for our public healthcare system. Last week, I received a letter signed by almost 100 New Brunswickers concerned with the further erosion of our public healthcare system, including the virtual care company eVisit MB and Acadie Bathurst Ophthalmology Centre. We've already seen a trend of privatizing management, with Medavie Health Services managing more things, from Ambulance New Brunswick to HealthLink MB. So why is the Minister of Health creating a private healthcare sector for Horizon and Vitalité to compete with for human resources?
Minister of Health.
Well, thank you very much, Mr. Speaker, and I am pleased to talk about some of the successes we have had in New Brunswick. I call them successes because we have increased the contact of people in New Brunswick with primary caregivers that can help them with the ailments that they are experiencing on a day-to-day basis. Yes, Mr. Speaker, eVisit NB is a project that is allowing people to get prescriptions renewed, get rashes looked at, get referrals to other doctors, get appointments. And Mr. Speaker, it's paid for by a person's Medicare card, not their Visa card. Mr. Speaker, that's public health care. Mr. Speaker, that's public health care being paid by Medicare. And Mr. Speaker, when you look at the number of providers right across the province, eVisit is a way, again, to increase the access to primary care. We can talk about the clinic up in Bathurst that was actually applauded by many, many people. Actually,
Minister. The member for Memramcook-Tantramar.
Mr. Speaker, the Minister of Health did not answer my question and is mixing up the issues. We are facing weakening the public health care system by strengthening the private part. The minister is missing the point, Mr. Speaker. We need to work on retention of nurses in our public sector so that they will want to stay and work within Horizon and Vitalité, and they're not competing with the private sector. And there shouldn't be profits to be made off the privatization and outsourcing of parts of our healthcare system, but that's what's happening, Mr. Speaker. Mr. Speaker, New Brunswickers value our public health care system. We expect our surgeries to be done by our doctors who don't work for big corporations, but once you bring in corporations into the mix, you'll have a lot of big companies whose goal it is to try to make a profit. So, Mr. Speaker, why is the Minister of Health opening the door for corporate-owned health care in the province?
Minister of Health.
well, Mr. Speaker, I think the member opposite would get a number of signatures from a number of the for-fee service doctors here in the province of New Brunswick that have been providing service to the population of New Brunswick for years and years. It's the same model, Mr. Speaker. A doctor charges a fee, it's paid by Medicare. The doctor looks after the equipment in his office, the doctor looks after the staff in his office, be it an RN or an administrator or a scribe. Mr. Speaker, that's the same model as that we're doing up in the Bathurst area. And I would suggest that the member opposite go up and visit the clinic, talk to Dr. Giovanni, and she will understand, Mr. Speaker, that this is an extension of the services offered by Vitality, again, paid for by Medicare, not MasterCard. Mr. Speaker, that is public health care. And as a matter of fact, it's actually extending the career of some RNs because they want